Digoxin, a well-known cardiac drug, used to be used historically as a poison. It's extracted from the foxglove plant, a purple plant, used to be mixed in with drinks. It would kill the person, the victim, and because there was no obvious clinical evidence, the patient would drop. No one would know any different other than the fact that the heart has stopped working. Well, with the advances in medicine, let's understand how it works. So digoxin essentially works by inhibiting the sodium potassium ATPase on cardiomyocytes. The sodium potassium ATPase essentially is your sodium potassium pump. What's the normal function? Well, this pumps out 3 sodium molecules out of the cell for every 2 potassium molecules into the cell using ATP made from ATP and PI by a condensation reaction. Well, if you're going to stop this from working, what's going to happen is you're going to have an increase in the intracellular buildup of sodium concentration. That's problematic. Why? Because don't forget, under normal circumstances, we need more sodium outside so as to allow an influx and therefore initiate an action potential and depolarize the cell. Well, because there's not enough sodium outside, we can no longer depolarize the cell. What does that mean? Well, that means that we're not going to actually allow for any depolarization. Therefore, this is negatively chronotropic. However, what the cell does is very cleverly, it employs the sodium-calcium antiporter. Sodium-potassium antiporter engages, and what it does is it pushes out the sodium and replaces for each sodium molecule by a calcium molecule. Now that allows for us to actually allow for depolarization and increase the sodium concentration outside the cell relatively. The advantage of the calcium inside the cell essentially is that it will allow for better contraction. So it will actually improve the force of contraction, which is great. Why? Because we can use that to our advantage in the context of systolic heart failure. Systolic heart failure is whereby the actual heart muscle is not contracting as strongly as it should, and therefore it compromises the ejection fraction, therefore the cardiac output. So in situations of cardiac failure, systolic cardiac failure, what we'll do is digoxin will actually improve the cardiac output, decrease the fatigue, and therefore improve the quality of life. So we can use this to our advantage, of course, in controlled doses. The usual community dose, what we gave is 62.5 micrograms, followed by 125 if we need to increase that. But we can actually use in a hospital setting, in A&E setting, we usually give loading doses of the likes of 500 micrograms, sometimes even 2 IV, and go from there. So there you go, digoxin, negatively inotropic, negatively chronotropic, positively inotropic. Thank you for watching.